House passed its plan to overhaul the nation's healthcare system late last night.
It would require most Americans to carry insurance and provide federal subsidies to those who cannot afford it. Both consumers and companies would be hit with penalties if they do not follow the government's mandates. Insurers would no longer be able to charge higher premiums based on gender or medical history. And the most controversial provision allows the government to sell insurance. The vote was pretty much split along party lines. Fox 11's Robert Hornacek spoke with several members of Congress about the vote and will offer multiple views.
The bill is passed.
It was late Saturday night when the House of Representatives narrowly passed a bill that aims to reform the health insurance industry.
I think overall it's a good bill. It's not a perfect bill, but it's a good bill.
Democrat Bart Stupak from the Upper Peninsula found himself at the center of the debate. He voted for the final bill, but only after the House passed an amendment he offered to keep taxpayer money from funding abortions. That amendment, he says, was the key to the bill passing.
Well, there's no doubt in my mind, a number of members came up and talked to me after that without us right-to-life Democrats not only passing our amendment, but then we were able then, in good conscience, vote for this piece of legislation, and it only won by 2.
The bill that we're moving out of the House is going to be good for America, good for American families.
Democratic Representative Steve Kagan voted against the abortion amendment. He voted for the final bill and says it will go a long way towards improving the system.
It begins to fix what's broken in our health care system, and it improves on what we've already got at a price we can all afford to pay.
Congressional estimates say the bill would expand insurance to 96% of the American people.
I think it could have been accomplished in a lot more economical way.
Republican Congressman Tom Petri voted for the abortion amendment and against the final bill. He says the bill could make the insurance system worse.
It's very likely it will raise the cost of insurance for young people and for middle-aged people. Senior citizens who have Medicare Advantage plans better look out because they will be placed under pressure.
Despite the House passage of the bill, there's still a long way to go before any changes take effect. First, the bill has to make its way through the Senate, and even if that happens, the health insurance exchange and the public option won't begin until the year 2013. Robert Hornacek, Fox 11 News.